I think for those patients who want to be engaged in their care, we absolutely need to enable it, and Direct and Blue Button are great ways to do that. But I would observe that I think the species Homo medicus is an elusive and slowly evolving species. And we'll see what happens over time as it becomes easier and easier for them. But I think a lot of times people are going to say, I don't want to manage my medical records. I want someone else to do it for me. And when something bad happens to me, then I really want it to be in place. And that's what we all need to, I think, be putting in place as a precursor.
We need to nail the provider to provider. At the same time, though, there is a lot of progress being made into provider to patient communication, as well as provider to payer and payer to patient. And so, you know, there's a lot of moving pieces, but we really need to nail this provider to provider this year and make this happen.
Data that is not used is useless data. And the reason why we have these problems right now is because not enough of us can send data from one party to the next, and so we don't resolve these issues.
My daughter goes to basically a safety net clinic in the southeast of San Francisco, and I was very excited because finally I had an EMR that I could get access to and go and see myself, first time ever. So I got very excited. I had to go and I went and I said, so to the doctor, how do I get it? And she said, well, you know, I didn't know that we had it. And then she figured out that I did have it, and then she said, well, no one's ever asked me for it before. And I went, well, I'm probably the only person in the southeast of San Francisco, which is not a wealthy neighborhood, that actually knows that this damn thing exists and you can do it. But the Palo Alto Medical Foundation has the same system. They have, I just saw Paul saying, they have 88% of their members on it because they marketed it to the right population, and frankly it was felt that, you know, the southeast of San Francisco didn't need it. So we need that marketing campaign. Along with that marketing campaign, the other part, which is kind of budding and waiting to get there, is the group of care navigators who are going to use Healthy Circles or whatever, who are going to actually run this for the, if you go back to what Mark Berkley said this morning, for the 15% of people who are really sick.